Today we are looking closely at rosemary, a common kitchen herb with a serious scientific profile. This video separates what is supported by human evidence from what is still only promising. Nothing here claims rosemary treats disease. We focus on what it may support, based on clinical research. Botanical and historical background. Rosemary is scientifically known as Salvia rosmarinus. It was formerly called Rosmarinus officinalis and belongs to the mint family, Lamiaceae. It is a woody, evergreen herb native to the Mediterranean region. Common culinary varieties include upright rosemary and creeping rosemary. The chemical profile is similar across varieties, though aroma strength varies. Historically, rosemary was used by ancient Greeks and Romans for memory, digestion, and preservation of foods. It was also used as a natural meat preservative long before refrigeration. Bioactive compounds and chemistry. Rosemary does not contain organosulfur compounds like garlic. It also does not produce allicin, and the garlic 10-minute rule does not apply here. The main bioactive compounds in rosemary are phenolic diterpenes and phenolic acids. Key compounds include carnosic acid, carnosol, and rosmarinic acid. These compounds are strong antioxidants and anti-inflammatory agents. Carnosic acid is fat-soluble and relatively heat-stable. Rosmarinic acid is water-soluble and more sensitive to prolonged heat. Chopping or crushing rosemary helps release these compounds. Gentle cooking preserves most antioxidant activity. Very high heat or long frying reduces potency. Extracts and essential oils concentrate these compounds, but potency varies widely by processing method. Nutritional profile per 100 g raw rosemary. Per 100 grams of fresh rosemary, the herb provides low calories and minimal fat. Dietary fiber that supports gut health. High levels of vitamin A, as beta-carotene. Vitamin C for antioxidant support. Vitamin B6 in modest amounts. Minerals include calcium, iron, magnesium, potassium, and manganese. Rosemary is also rich in polyphenol, which are not listed on nutrition labels but drive most health effects. Evidence-based health effects. Cardiovascular health. Human studies suggest rosemary may support cardiovascular health, not treat heart disease. A randomized controlled trial published in Phytotherapy Research found rosemary extract improved antioxidant status and reduced lipid oxidation in adults with metabolic risk factors. Small human trials show modest reductions in total cholesterol and LDL when standardized rosemary extract is consumed for several weeks. Blood pressure effects are mild and inconsistent across studies. Rosemary should be viewed as supportive, not antihypertensive therapy. Antimicrobial properties. Human clinical evidence is limited but growing. Rosemary extracts show antimicrobial effects against bacteria and fungi in food and oral health settings. A human study in Journal of Food Protection showed rosemary extract reduced bacterial growth in meat products consumed by humans, indirectly lowering exposure. Clinical use against infections is not established, but it may support food safety and oral hygiene. Anti-inflammatory and antioxidant effects. This is where rosemary has its strongest human evidence. Carnosic acid and rosmarinic acid reduce inflammatory markers in human trials involving oxidative stress. A controlled study in evidence-based complementary and alternative medicine showed reduced markers of inflammation after rosemary supplementation. These effects may support joint health, vascular health, and general cellular protection. Potential anti-cancer properties. There is no human clinical evidence that rosemary treats or prevents cancer. Epidemiological data suggest diets rich in herbs like rosemary are associated with lower cancer risk, but this is correlation, not proof. Human relevance is still indirect and mechanistic. Claims should remain cautious. Immune and respiratory support. Rosemary may support immune balance through antioxidant activity. Human trials show reduced oxidative stress, which indirectly supports immune function. Traditional use for respiratory comfort exists, but clinical human trials are limited. This remains a may support area. Blood glucose regulation. Small human studies suggest rosemary extract may improve insulin sensitivity and reduce post-meal glucose spikes. A clinical trial in adults with insulin resistance showed modest fasting glucose reduction after several weeks of supplementation. Effects are supportive and mild, not a replacement for diabetes treatment. General body system support. Rosemary supports digestion by stimulating bile flow. It may support cognitive alertness and mental fatigue based on small human trials using aroma and oral extracts. Again, effects are supportive, not therapeutic. Optimal consumption practices. Culinary use is the safest and most studied approach. Human studies commonly use 2 to 5 grams of dried rosemary per day, or 300 to 1,000 milligrams of standardized extract. Fresh and gently cooked rosemary retain most benefits. Long high-heat frying reduces antioxidant content. Rosemary compounds are fat-soluble, so pairing with olive oil improves absorption. Unlike garlic, there is no 10-minute waiting rule needed after chopping. Supplements should be standardized for carnosic acid content. Safety and contraindications. Culinary amounts are generally safe for healthy adults. High-dose supplements may interact with anticoagulants like warfarin due to mild antiplatelet effects. Possible side effects at high doses include stomach upset and nausea. Rosemary supplements should be avoided before surgery. Pregnant and breastfeeding women should avoid concentrated extracts. Food level use is generally considered safe. Supplement quality varies widely, and lack of standardization is a concern. Key takeaway. Rosemary is a supportive functional herb, not a cure. Its strongest human evidence is in antioxidant and anti-inflammatory support. Used regularly in food, it contributes to long-term health patterns. If you value evidence-based nutrition explained clearly, please like this video, subscribe to the channel, and share it with someone who loves healthy food. Follow us for more science-guided insights into everyday herbs and spices.